Hello, welcome to Mind Matters with Dr. Gochukwu Ojiako. In the fourth series of anxiety disorders, we discussed agoraphobia, its presentation, diagnostic criteria, clinical management, and comorbidities. If you have not watched the first, the second, the third, and the fourth series already, please endeavor to do so in order to better understand our upcoming series on the other types of anxiety disorders. So today, we will be discussing social anxiety, also known as social phobia. Social anxiety is a remarked, persistent fear of social or performance situations in which embarrassment may occur. The anxiety level associated with social anxiety is significant to fit criteria for situational panic attack. The disorder has a prevalence rate of 3 to 13% among the United States population. The occurrence rate is the same for male and females. Assessment involves collecting history to assess the following. If the individual is experiencing a type of social anxiety that is common and normal in adolescents. If symptoms have been present for more than 6 months. And this is because for a diagnosis of social anxiety to be made, symptoms must have been present for more than 6 months. Assessment is also done to see if onset was in the mid-teens. Social anxiety onset is usually in the mid-teens following a stressful or humiliating experience. Symptoms tend to decrease with age. Differential diagnosis is assisted by the awareness that individuals with social anxiety do not verbalize feeling better or having less anxiety when accompanied by a trusted companion, unlike in agoraphobia. Common features of social anxiety are hypersensitivity to criticism, negative self-evaluation, low self-esteem, and lack of assertiveness. Also, there is protracted anticipatory anxiety days to weeks before a social event that is anticipated to cause anxiety. The subjective distress and impaired function associated with social anxiety is significant and have been associated with suicidal ideation. Physical exam findings in a person that is experiencing acute anxiety includes tremors, sweating, muscle tension, palpitation, diarrhea, and blushing. Mental status exam is consistent with anxiety. Thought content is consistent with social anxiety. There is actually no specific laboratory testing or diagnostic exam to diagnose or rule out social anxiety. So diagnosis is made based on reported symptoms, reported behavioral pattern, or observed behavioral pattern in the individual. Clinical management involves following the general guidelines of anxiety treatment, which includes medication and non-medication management. Medication management entails selecting medication from the class of antidepressants known as SSRIs or selective serotonin reuptake inhibitors such as Zoloft, Prozac, or Celexa. SSRIs are usually used to treat anxiety. However, benzodiazepines, such as Xanax, can be used for short-term treatment of anxiety as well. Beta blockers are used off-label for the treatment of discrete episodes of anxiety. Take, for instance, if one is scheduled to attend a social event that is anticipated to cause anxiety, the person can take beta blocker for anxiety relief prior to the social event. Non-medication management involves CBT or cognitive behavioral therapy, exposure therapy, or relaxation therapy. In our future video, we will discuss specific phobia. Our email address is located in the description, so please feel free to send us your general questions. We will randomly select questions to be addressed in our future videos. So like, comment, subscribe, and share this video with your friends and your families. Thanks for watching. I am Dr. Ogochukwu Ojiako. Thank you.